As I said earlier, my name is Gary Onokite, researcher into medical sciences. Now I want to discuss about something very common among many advanced old humans today in all parts of the world. And that disease that is very common is no other than high blood pressure, or known to be hypertension. So we may wonder, what is hypertension? Hypertension, commonly known as high blood pressure, happens when the pressure of the blood being pumped through your arteries is higher than what it should be. So if it is higher than what is the normal range, then it is very confirmed that you have hypertension or high blood pressure. Or you may say that is higher than normal measurement of the blood level expected for it to be. Hypertension happens suddenly without signs or symptoms, taking the sufferer unaware. That many people who have this illness do not know they have it. Hypertension can be silently deadly or severe at times when it happens to somebody, because such a person cannot easily detect whether he have it or not, especially when such a person do not regularly check his blood pressure. Why? Because it does not come with any symptoms to prove that such a person have it. Many people in the world are at risk of having hypertension. The percentage of hypertension is increasingly worldwide, increasingly getting high worldwide. What are the types of hypertension? Yes, we have the first one, primary hypertension. This type of hypertension has no direct possible causes. It always results from sedentary lifestyles, drinking too much, smoking, bad habits of lifestyle. And it also happens when someone is obese, that is obesity, being overweight. That is the primary hypertension. Then the secondary hypertension is as a result of known or identifiable causes. This hypertension can result from pathophysiological mechanisms such as regulating plasma volume, peripheral vascular resistance, and cardiac output, which may all be increased. So it could be due to different medical complications. Other types of hypertension. We also have malignant hypertension. Unlike normal or moderate hypertension, malignant hypertension has very noticeable or identifiable symptoms, such as blurry visions. You will not be seeing clearly, everything becomes dim. You also have chest pain. You'll be feeling feeling pain on your chest. Nausea, feeling sick, or vomiting. That means you'll be vomiting food that you eat. Weakness in the arms or legs. Shortness of breath and reduced urine input. Your urine does not flow effectively. We also have resistant hypertension. This type of hypertension happens when, after using your medications prescribed to you by your doctor, there seems to be no indication that your blood pressure is coming down or is decreasing or becoming balanced or moderate. So this type of hypertension is a resistant type. After using medications, there's no sign of improvement. So this type of hypertension is very hard to treat because there's no sign of proof of the drug reducing the blood pressure. So due to this prevalence of resistance, doctors may investigate secondary cause such as one, hormonal abnormalities that balance and control the blood pressure. Secondly, an accumulation of artery clogging plaque in blood vessels that feeds and nourishes the kidneys. Thirdly, sleeping problems such as breath holding type of snoring regularly all night, commonly known as obstructive sleep apnea. And the fourth on the list is obesity or too much consumption of alcohol or other substances that interferes with the blood pressure. Now we want to discuss about another form of hypertension known as pulmonary hypertension. Pulmonary hypertension comes in different forms. Some are serious conditions, while others can be treated with medications and also improve the standard of life. The treatments depend on the particular type. What are the symptoms of this pulmonary hypertension? They include shortness of breath during routine activities, such as climbing 2 flights of stairs. You also have fatigue. You also have chest pain, raising heartbeats. Your heartbeats begin to beat speedily. Then you have pain in the right abdomen near the liver. Then your appetites become low. That is the pulmonary hypertension. Then another form of hypertension is pseudo hypertension. This type of hypertension is a falsely elevated blood pressure reading taken from the reading machine. So the blood pressure reading is not accurate. This actually happened as a result of calcification of blood vessels which cannot be compressed. What are the risk factors of this form of hypertension? One is genetics. Having family members with hypertension also increases the likelihood of such a family or individual to have the hypertension. Another is race. This race has to do with either you are black or white or Asian. So it is more common in people with dark skin, that is Africans, Americans, than in people with pale skins, the Europeans and the white Americans and the likes. The risk factors also include aging. As you grow older, your blood vessel becomes more rigid, preventing them from opening as effectively as when you are younger. These are some of the types of hypertension that are available in the whole world today. So what are the causes of high blood pressure? They include kidney disease, diabetes, obstructive sleep apnea, a condition in which the walls of the throat relax and narrow during sleep, interrupting normal breathing. So your breathing don't becomes normal anymore when you sleep. Instead of breathing well, your breathing begins to cease. Or you have glomerulonephritis. That means damage to the tiny filters inside the kidneys. Narrowing of the arteries supplying the kidneys. Then you also have hormonal problems such as an underactive thyroid, an overactive thyroid, Cushing syndrome, acromegaly, increased levels of the hormone known as aldosterone and phycromocitoin. These are some of the causes of high blood pressure. Those are not just all. You also have another form, which is lupus. It's a condition where the immune system attacks parts of the body, such as the skin, the joints and the organs in the body. Then you have scleroderma, a condition that causes thickened skin and sometimes problems with organs and blood vessels. So these are the causes of high blood pressure. So what are the diagnosis and tests of high blood pressure? So high blood pressure is measured using a pressure cuff or an electronic device placed on an upper arm. The blood pressure is measured in two numbers. The higher one is the systolic pressure, which represents the maximum pressure in the circulatory system when the heart pumps blood, while the other one, the lower one, is the diastolic pressure, which is the minimum pressure where the heart refills. So normal resting pressure, blood pressure in all adults is 120/80 milligram Hg. This is the normal range of blood pressure. So readings are generally higher in the afternoon and lower in the night. So we have what is called prehypertension, which is 120/139, and also stroke 80/89 millimeter Hg. This is the normal range of hypertension. So what is the stage of the first one hypertension? This first one is known as stage 1 hypertension. It's 140/159 stroke 90/99 milligram Hg. While stage 2 hypertension is 160 stroke 100 millimeter Hg or higher. All this range shows that the blood pressure is high, which serve as a risk factor to determine that you have hypertension. So the both numbers in the blood pressure reading are important. An increase in either number, being it systolic or diastolic pressure, indicates you are having hypertension. It is also very important to note that a blood pressure that is below 90/60 millimeter Hg is considered as hypotension. So hypotension is different from hypertension, which is known as low blood pressure. What are the treatment and medications for hypertension? One of the treatments of hypertension or high blood pressure is changing of lifestyle. When you change your lifestyle, it will go a long way toward controlling your high blood pressure. So you have to avoid sedentary lifestyle. Your doctor may recommend you eating a healthy diet low in salt. So your salt intake must be low, must not be very much, because high salt intake increases high blood pressure. Also, you may also need to exercise regularly and quit smoking of all kinds completely. You stop smoking completely and maintain a healthy weight. You eat what will be able to satisfy you. You don't overeat, and you don't eat too much fatty food that will make you to gain more weight so that you become obese. Your doctor may also recommend medication to lower your blood pressure. Medications to treat high blood pressure are thiazide diuretics. This drug help eliminate sodium and water, thereby reducing blood volume. Thiazide diuretic also include hydrochlorothiazide, which is known as microzide, or clothalidone, etc. You also have another drug known as beta blockers. These medications reduce the workload on your heart and open your blood vessels, causing your heart to beat slower and with less force. So beta blockers include acebutolol, known as Sectra, atenolol, known as tenomine, and etc. So beta blocker works well when given alongside another blood pressure medication. So when using a beta blocker medication, it works effectively with another blood pressure medication. Another form of medication used in treating blood pressure is calcium channel blockers. This medicine includes amlodipine, or known as Norvasc, very common in treating blood pressure. You also have diltiazem, or known as cadizen, or Tiazac, etc. These drugs help relax the muscles of your blood vessels. Some also slow your heart rate. So this calcium may work better for black and older people than ACE inhibitors alone, a drug known as ACE inhibitors. Other form of medication is known as alpha blockers. These medications reduce nerve impulses to blood vessels, reducing the effect of natural chemicals that narrow blood vessels. These drugs include doxazosine, known as Cadura, prazosin, known as Minipress, or etc. After knowing most of all these important things that you need to know about blood pressure, is it possible to prevent blood pressure? Yes, there are prevention. One of the ways is maintaining a healthy weight, so you don't eat too much to become obese. Another way is getting regular exercise. Another is reducing your salt intake. And fourthly, reducing the stress you undergo, because stress can make blood pressure to high, so you don't do too much stressful job so that you do not get high blood pressure. The fifth way is your potassium intake. So you have to eat foods that is rich in potassium. This will help protect you from developing high blood pressure. Then you also have to eat many fruits, vegetables, dairy foods, and fish. All these are good source of potassium. So this will enable your body system to avert having high blood pressure. The sixth way you can prevent high blood pressure is your use of calcium. So people with low calcium intakes have high rates of high blood pressure. So it is very important and necessary that you use calcium, because it is recommended to get at least 1,000 milligrams of calcium per day for adults from 19 to 50 years. Although it is not proven yet that calcium prevents anybody from having high blood pressure, but it really helps in preventing it. Or you may choose a quantity of 1,200 milligrams of calcium to be used for those above 50 years. Then dairy foods like low fats and dairy products without fats are also proven to have calcium than high fat dairy products such as milk, chocolates, and yogurts and all the likes. The seventh procedure you can use in preventing high blood pressure is by using of magnesium. A diet low in magnesium may also make your blood pressure rise, so it is very important that you have high intake of magnesium. Doctors do not prescribe high magnesium to prevent blood pressure. The amount gotten from healthy diet would be enough for you to help prevent it. You also have fish oils. Fish oils such as omega-3 fatty acids found in fatty fish like mackerel and salmon, known as Titus and sardines, may help reduce high blood pressure. but it is not proven medically if it does because the findings is unclear. But getting omega-3 fatty acid is the best to help prevent it. Then you also have to take the 8th procedure, which is garlic. Your intake of garlic should be regular because it is very important. It also helps in lowering the blood pressure. Although there have not been proven evidence to suggest garlic's effect in lowering blood pressure, in addition to improving cholesterol and reducing some cancers, but garlic does really help because there is more research ongoing on the effectiveness of garlic in treating many medical conditions. So I hope you have gained some important information about hypertension, commonly known as high blood pressure. I'll hereby encourage you to continue with more medications information as I introduce you to other topics that affect us generally in the world.